Hello, today is Wednesday, June 22nd. I just had my appointment at the cancer clinic. So I met my oncologist, Dr. How do you say her name? Dr. Manna. I don't want to get that wrong. She is absolutely lovely. She's just lovely. She's a woman, young, really, really nice, really down to earth, really personable, so easy to talk to. Her nurse Steph was also really, really kind and nice, and honestly, from the moment I walked in, it was a little bit nerve-wracking, but then everybody was so friendly and so nice. They're really good there, and I mean, they deal with this all the time, but they made me feel so comfortable and calm. So I went to my room with the nurse, and after she took my height, weight, and blood pressure, and then the nurse just kind of screened me with some routine questions. I did fill out a little sheet when I first got there on any concerns I had. They also asked me to kind of rate how I was feeling on specific things. So the nurse just kind of went over those things with me if there was anything I wanted to ask her specifically or ask the doctor when she came in. So that was really nice. Then when the doctor came in, she just did a quick exam, and then she let me change back into my clothes so we could have the rest of the consult where I'm, more comfortable rather than in a gown. So she came back in and we just kind of went over treatment and the plan that she has made for me. So she decided that she's going to do 5 months of chemo right away. It sounds long, but the way they break it up kind of makes sense. So they break it up in cycles. So each cycle is a treatment. So she's going to start me off with phase 1. I'm going to go in every 2 weeks for a total of 4 cycles. So that will cover the first 2 months. So the first 2 months, I'll go in every 2 weeks and have 2 different types of chemo. I'm not even going to try to pronounce these words, so I'll just put them right here. But that is phase 1 for the first 2 months every 2 weeks. So after phase 1, we'll start phase 2 right away, and that'll go for 3 months. And instead of going every 2 weeks, I'll go every single week for 12 cycles, so total of 3 months. They're going to start me on something different, and every time I go for phase 2, they said it should take about 4 hours, whereas before I think it would take 2 hours sitting there while you get your IV. So phase 1 will take 2 hours every time, and then phase 2, I should be there for 4 hours every single week. So that's what I'll be doing for those last 3 months of treatment. I also should have mentioned that during phase 1 and phase 2, I will have an injection following chemo that I'll have to do on my own. This is going to help me, my bone marrow, make new white blood cells because everything will just be so depleted. So it'll help protect me against infections, bacteria, getting run down, getting sick. So this injection I'll have to do throughout the whole 5 months. And they will show me how to do it at home. So that's another part of it I just should mention. So to sum it up, my visit today at the cancer clinic was actually really positive, and I was going in feeling really sad and kind of down. And after meeting everybody, I feel really good about it, and I have such a great team. I was even given a support social worker who's a woman as well, and also just so easy to talk to and friendly. They also give you this cute little book, which I'm obsessed about because I like to organize and plan my life, and the whole thing is just so cute. It has all these little tabs and just all these little places for you to fill in how you're feeling, each treatment, keep notes on things. So I was really excited about this. I felt like I got a little present. So now I am still waiting for my heart echo exam just to make sure my heart is healthy. And then I should get a call tomorrow, they said, from the cancer center to set up my first treatment. It might be next week, but if it's not next week, it'll for sure be the week after. Next week there's a stat right in the middle of the week for Canada Day, so makes their week kind of a short week. But yeah, I'm just kind of waiting now and trying to get ready and trying to prepare as much as I can. And I think I'm gonna go wig shopping maybe this weekend. They did tell me that usually after the first treatment, your hair could fall out, and for sure by the second treatment, it'll start falling out. So I just want to have a wig ready to go.